Hello, and welcome to Time to Change's e-learning module about social contact. When you have finished this e-learning module, you should be able to define social contact, identify situations where you could use social contact in your own life, explain how social contact can be used at activities or events. So firstly, what is social contact? We'll start by showing you an animation of what social contact is and then talk this through in some more detail. As you've seen in the animation, social contact is a way to change how people think and act about mental health. We can use it to help people have more positive attitudes towards those of us with mental health problems. The main idea of social contact is to let someone get to know you, and then at some point in the conversation, you let them know that you have experience of a mental health problem. This shows them that you are a person just like anyone else, which may change the way they think about what someone with a mental health problem is like. When you're using social contact, it can be important to remember why you're doing it. You just want to show the person you're talking to that you're a person just like anyone else, even though you have experience of a mental health problem. Through your conversation and many other conversations across the country, we gradually change the way people think about people with mental health problems. You don't need to share very many details of your story to change attitudes. This is different to getting support for your mental health, where you might talk more about how you're feeling and what's happened or is happening in your life. There are lots of different ways to use social contact to change the way that people think and act about mental health. In this section, we'll talk you through some of them. One important thing to think about is where you'd like to use social contact, as you can use it in lots of different places and situations. For example, with friends and people who know you but didn't know you have experience of a mental health problem. With strangers you've just met, on social media, or at activities and events. We'll talk you through how each of these would work. So firstly, you could use social contact with people you know. This can make a massive difference to the way they think about mental health. This is because they already know you and see you as a part of their lives. So you can make mental health relevant to them and show them that it's a normal part of life. Have a think about the people in your life. Who have you told about your experience? Are there people that you would feel okay to tell who you haven't told already? You could also use social contact with strangers you've just met. This could be on the bus, at the supermarket, or anywhere else where you could talk to someone. You could start by talking about an everyday topic, then mention something about your experience. It doesn't have to be a lot. For example, you could talk about how the weather can affect your mental health, how being on a crowded bus or deciding what to buy in the supermarket affects you, or just mention the fact that you have experience of a mental health problem at some point in a conversation about something else. If it feels safe for you, you can use social media to post about your experience. You could add mental health to posts you would write anyway, for example, mentioning when things make you anxious, angry, or scared. Or you could write status updates about your mental health and how you're feeling that day. Some champions have also posted about their diagnosis, but we'd only suggest you do this if you've thought through the consequences of people knowing your mental health diagnosis. Remember that anything you post could potentially become public and be seen by anyone online. Here's an example of how you could bring your mental health into conversation. If someone comments on how lovely the weather is, you could reply with how the weather affects your mental health, and then go on to mention something about your experience. If you'd like to change the way lots of people think and act about mental health, you might like to think about running a social contact activity or event. Social contact activities and events follow the same pattern as social contact in your everyday life. You find a way to start a conversation, then bring the conversation around to talking about your mental health. One of the great things about using social contact at an event is that you can be really creative in finding a way to get the conversation started and make the activity or event your own. You just need to find a way to attract people to talk to you so they want to know more. An example of this would be to start making some art or to make some origami shapes to get people talking and then bring the conversation around to mental health. Alternatively, you could do a mental health themed activity. For example, a pledge wall, where you ask people to pledge to do something to end mental health stigma. Then you mention your own experience. We have loads of ideas for other activities and events you could do at this link. It's important to remember that we are trying to change the way people think and act about mental health, who don't already know very much about mental health. You may be approached by people who have mental health problems themselves, looking for support or advice. You might like to take some numbers with you for the Samaritans or the Mind Info Line, who can provide support and information about mental health. It's best if you can keep conversations with people who have their own experience quite short, so that you can speak to people who don't know very much about mental health problems and are more likely to have negative attitudes. Usually people don't share their negative attitudes towards people with mental health problems, but sometimes they might make a comment that lets you know that they do have negative attitudes. When this happens, it can be upsetting, but it's also a good opportunity to challenge what they think. Here are 2 ways that you could challenge people. You could challenge things they say with facts. For example, you say that you don't know anyone with a mental health problem, but 1 in 4 people you know will have a mental health problem. Or you could challenge using your own experience. For example, you say that people with depression are lazy, but I am here campaigning today, even though I find it hard. When you need to end the conversation, here are some tips. Firstly, you could see if there's anything nice and honest that you can say about the impact the conversation has had on you, to help them think about ending your chat by saying something like, "I know I've got a lot out of this conversation. I really felt that you listened to me." Or you could start to talk about what they might like to do next by saying things like, "So what are you going to do this afternoon?" This will get them thinking about their next steps. Another way to end is to say, "I'd love to talk more, but I've got to go and speak to some other people today." You could then invite them to check out the website if they have any more questions. If you're struggling and the person wants to keep talking, you can also make an excuse to leave. For example, "I have to go on a break now," or even, "I'm sorry, but I need to go for lunch." It isn't always easy to share your experience, and it's important to make sure you have a plan for what you're willing to share and how you'll look after yourself after you've had your conversations. In this section, we'll talk you through some ideas for looking after yourself. Whether you're deciding to share with friends and family, with strangers, online or at an activity, an important first step is to think through what you're comfortable saying about your experience and what you aren't. Think about what you're comfortable with telling people. Are there any parts of your story that feel painful or vulnerable that you might not want to tell people about at the moment? If you're unsure about what to share, think about how you would manage if someone reacted badly to your story. If they were dismissive or negative, would you be able to cope? It's not likely to happen, but it is possible, so you should think about that when you are deciding which parts of your personal experience you are prepared to share. Have a practice with someone you trust before you talk to people you haven't told before. Think about who you are talking to. How well do you know the person? If you haven't shared your experience with very many people, do you feel comfortable telling this person? Think about why you are sharing. Remember that social contact is about changing the way someone thinks about mental health by sharing some parts of your story. Social contact is different to getting support from someone. Think about where you're sharing. It's great to share your experience in public, but remember that it isn't a private conversation. If you're sharing somewhere where there are other people you know, for example at university or work, think about whether you would be happy with anyone there knowing what you're saying. Make sure you just say what you're comfortable with. If you're doing an activity or even sharing with someone for the first time, try to plan something nice to do afterwards. Think about what you enjoy doing and what you'll look forward to. Also, make sure you think about what you'd do if you had a difficult conversation. If you are struggling and need someone to talk to, you can contact the Samaritans, 24 hours a day, free of charge, on 116123. We also have some ideas for looking after yourself on our campaign portal at this link. We hope that this module has helped you to better understand social contact. To test what you've learnt, take our quiz below. When you have filled it in, you will be able to print a certificate saying you have completed this social contact training module, as well as to provide us with any feedback.